I was tagged. Let's watch.
Why is going... You know what? Explain it to me. No, don't explain it to me. Justify it. I want a pharmacist in here to justify the behavior to me. Tell me, I'll give you the example. I'll walk you through the whole thing. The doctor calls in a script. This script. This is a topical acne medication that I have been on and off of my entire life. It sits on the pharmacy shelf in this box, just like this. They don't have to count out any pills. They don't have to weigh anything. There's nothing to do other than scan the barcode on this box and let me pay for it. To the pharmacy, they are fully staffed, but there is not another customer there. There is no one there waiting. They're not on the phone with anyone. Nothing is going on. It's just two people sitting at a computer, and I walk up and I'm like, hey, my doctor called in a script. They asked me for my birth date, and then they proceed to ask me for my first name, my last name, my social security number, and my address, just to be able to look me up, because apparently the phone number wasn't good enough. I don't know. With the prescription sitting in front of them on the computer screen, they then go back and forth with me for about 15 minutes over what it is. She walks to the shelf. She picks this up off the shelf. She walks back and she goes, look at that. We have it. This is where I'm thinking, oh, I'm just going to get to pay for it and go.
It's not how it works.
She looks at me and she dead ass says, it'll be ready in about 15 minutes.
Yeah.
Okay. So I go and I sit in the little row of chairs. Again, there's no one else there. I sit and I wait for not 15 minutes, but 30 minutes. I say nothing. They do nothing. In this 30 minutes, to me, it appears nobody does anything. After 30 minutes, I finally get up and I'm like, hey, I really have to go. Don't you think since it's just sitting there, like, maybe I could pay for it and just leave? She looks at me and she goes, it'll be another 5 minutes. For what?
I'm Ethan, I'm a pharmacist, and I worked in retail pharmacy for 12 years, so let's talk about it. I think really the moral of the whole story is that the world in the pharmacy does not revolve around you. The reason we can't just pull a prescription off the shelf and slap a label on it is that there are many steps to it. Also, when it comes to prescriptions, there are usually several before you, especially for people who they may be going online and reordering a refill or calling in a refill, or doctors are sending in prescriptions for patients that are going to be coming straight from the doctor's office looking for their prescription to be ready. But the process of refilling a prescription is multiple steps. First, we have to refill it, then it has to be verified by the pharmacist, then it gets printed out, then it has to be filled, and then the pharmacist has to recheck it, and then that's it. But again, this is happening for several other prescriptions that were either called in or sent in before yours. This is why I recommend, if you are gonna be complaining for having to wait for a prescription, especially if it's a refill, I would simply just call it in and most likely it will be ready.